back to the studio, and just like we mentioned a bit ago, the stomach germ, or what is known as Helicobacter pylori, or the spiral germ. It's a germ that infiltrates the stomach to settle in the cells of the gastric mucosa, which leads to inflammation in this membrane and the destruction of the cells in it. Stomach germs is a common and widespread disease among people, with a rate of up to 50%. Contrary to what is rumored, the stomach germ is not the only cause of stomach ulcers, but it helps in creating a fertile environment for its appearance. To know more about the stomach germ, its symptoms and methods of treatment, we are pleased to have with us today Dr. Ghanem Alsalem, a consultant in internal medicine and gastroenterology. Good morning, doctor, and thank you for being with us.
Thank you for having me, and good morning, Kuwait, and good morning to everybody. Good morning to you and to the staff. And it's a pleasure to be here on this beautiful morning. Today we are on this season, we're coming into the winter time. It's the time where people get out, enjoy the weather, and
enjoy dining out.
Enjoy dining out.
And come back to you guys.
Exactly, that's it. So that's why we are having these kind of campaigns from time to time, go to the media to kind of give them the hints how they enjoy their life with a healthy life, healthy diet, healthy exercise, and the best way they can enjoy the moments of their life. And also I would like here to thank and congratulate Qatar for hosting the World Cup.
Oh, yeah.
And I'm sure people are watching this amazing, wonderful worldwide.
Tonight is the big game.
It's the big game.
Who are you cheering for?
We are for Morocco, and I hope for them to succeed to the final and hopefully get the cup. And we are all proud of the Arab country Morocco. And also I would like to encourage people to have this in their life, the exercise, watch the soccer. They will encourage them to do more exercise.
And doctor, before we move on to our topic today, the stomach germ, let's talk about stomach chills and excitement.
Yes.
Who are you cheering for tonight? Argentina or Croatia?
This is a difficult one. I like both teams. They are both doing very well so far. Probably most of the Kuwaitis are with Messi, so probably we will.
Except for me.
Okay, so
I'm actually cheering for Modric.
Okay.
I think he's done a wonderful job. The Croatians are incredible.
They had a very beautiful game against Brazil, so they proved themselves, and they're worth to be watched tonight.
Oh yeah, definitely an exciting game, but also an exciting topic here in studio.
Yes.
Actually, not so exciting. It's a topic that people hate and avoid, but we need to be aware of the symptoms and how to actually protect ourselves and especially our children. Let's talk about the stomach germ. How does it happen and what is it exactly?
That's a good topic to talk about, really. And you're touching what people are asking me most of the time. Where we go to the Duania, you were in a gathering or wherever, they will always ask you about the stomach germ, or what they call it, the H. pylori, or the Helicobacter pylori, or the spiral germ, wherever you said in your introduction is true. And this is what the people are asking about. What is this germ? What is doing to us? How we know we have it? And you can say that most people, they do have, either they know somebody had it or they do have it themselves and they want to know how to treat it. This, it's a kind of infection, it's a bacteria. It goes to inside your stomach. It kind of has a special, let's say, characteristic or special feature that's in stomach, it's acid. So almost everything in the acid actually get digested. But this bacteria has the ability to protect itself, so it can produce some lining around it and protect itself from the acid. And there is the problem, it stays there for a long time. Sometimes gives symptoms, sometimes it doesn't give symptom, and sometimes the patient present with the complication of the H. pylori.
You mean like there are people who actually have it,
yes,
but they don't show any symptoms and they don't know they have it?
Yes, that's true.
So how are they affected?
They are affected, but they don't have it now. At the moment, the germ is kind of sleeping, but at some stage in life they will go. So if the patient comes to the clinic and they have the symptoms of H. pylori, for example, if we go through the symptoms now, they have, for example, dyspepsia, that's difficulty digesting food, or they have some stomach pain, sometimes vomiting. Some of the patients just come with anemia. There's no other thing else. Some patients may come with complication like ulcers.
So it causes anemia as well?
Yes, it causes anemia.
Wow, I never knew that.
Yes, one of the things you have to check if you have anemia, iron deficiency anemia. So we test them for the H. pylori, and then, sorry, you have the H. pylori, you need to treat it. the patient will ask me, since when I have it? I just had the symptoms yesterday or the day before or last week or last month. We cannot tell exactly the time lane when the patient got the H. pylori. We don't have any method at the moment to know if you get infected last year or just yesterday.
Okay, doctor, let me ask you a question. Are there other diseases that, just now you mentioned anemia,
yes,
occurs when you have that
yeah,
germ. Are there other diseases that are associated or that start showing up after having this germ living inside your stomach lining for so many years?
Yes, that's what we call the complication of the infection of H. pylori. And these are things where we want to prevent them to happen. So that's why we have this education to the population, to the people. You must visit your doctor if you have these symptoms, because we don't want you to get the complication. The complication, 5 to 10% of the patients or the people who get infected with H. pylori. And the most dangerous one is the cancer. 1 to 3% of the patients who H. pylori, they do have cancer of the stomach and they present with cancer of the stomach, or the ulcers, where the ulcer is just the break through the stomach and then you start to bleed internally and you don't know that you are bleeding inside.
Oh God.
So you present with severe anemia, or you present with vomiting with the blood, or you may see blood in your stool or black in your stool. These are the complications and dangerous signs if the patient has them, and then you need to treat them for the H. pylori. So these are the complications the patient may present with.
These are deadly complications you're talking
deadly.
about.
The cancer is deadly,
so
the ulcer deadly, yes.
What I understand from what you're saying is that once you have stomach pain or other symptoms, you shouldn't ignore it, because if you ignore it, chances are it'll develop into something else and you'll be one of the unlucky 5 to 10% who will get a deadly disease.
Yes, let's comment on
this.
So yes, I don't want people to be scared.
And depressing.
Yeah, I don't want people to be scared. I want them to be aware. So there is a difference between being scared, you don't take things over, but at the same time to be aware of these symptoms. If you have something like disturbed stomach, you think your stomach is not acting well recently, or you feel that digesting the food is not as it used to be, or you think your weight loss, your weight becoming less with no exercise or dieting, unexplained weight loss, or you think you have anemia, or the patient may have just pain in the stomach and surrounding the area in the middle of their tummies, and they cannot explain why they have the pain. You do have to visit your doctor to investigate the H. pylori. And if you do have it, there is a treatment and you can get rid of it and you're back to your life. So prevention is better than treatment. And
you know, doctor, a lot of people think they just have GERD.
Yes.
Let me take an antacid.
Okay.
I take an antacid and I feel better immediately.
Yeah.
So there's no need to really investigate.
Yes.
So what do you tell these?
That's a good thing. This is a very good point you're touching. There are differences between GERD, gastroesophageal reflux disease, and the stomach gastritis. Patients who have H. pylori, the H. pylori doesn't cause GERD, doesn't cause the reflux. It only affects the stomach. So it doesn't affect your esophagus, because the reflux is affecting your esophagus. Too much acid production or something, you have a loose gate between the stomach and the esophagus, and the acid starts to go up in your esophagus, and you have the symptoms of heartburn, sometimes your voice gets disturbed, or you have some chest pain. But the H. pylori usually focuses on the symptoms mainly down a little bit at the stomach level, and there is a difference between the two. Taking antacid may help in actually patients with H. pylori, and it may mimic or may mask, let's say, the symptoms and give the patient the feeling they are cured and they don't have the H. pylori. So don't take the medication without consulting a doctor. That would be good. And if it's recurrent symptoms, let's say you did take antacid, you are outside Kuwait, for example, or you don't have access to doctor, and then you took the antacid and you felt well. If you get the symptoms back again, it's better to go and investigate. It's safer.
And let me ask you a question. Is it contagious? Like if there's a member in the family who has it, how are they most likely to give it to somebody else? Through sharing a spoon, for example, or what?
It's a very common question in the clinic, especially when there is husband and wife coming in and they say, oh, he has H. pylori, let's stay away from him. No. The H. pylori gets around the population, around the people from food mainly. and unclean hand. So when you prepare the food with unclean hand, you may actually get people infected with H. pylori.
Even cooked food?
Uncooked food sometimes, and well-prepared food sometimes. And patients or people who are preparing the food, you know, they have always to have their hand hygiene well, because you know they can, if they clean themselves or something, they have to clean their hands before they prepare the food. And we think the main reason for the H. pylori to be in the population is through the food, but it doesn't go through the sharing spoons or you know, sharing live or in the household. It's mainly through the food.
Dr. Ghanem, I remember during my pregnancy,
yes,
my doctor told me to avoid salads.
Yes.
Especially at restaurants.
Yes.
And to avoid sushi.
Yes.
So I noticed that it's mostly raw or uncooked food.
Yeah.
And chances are you won't get any of these stomach germs or bugs when you eat food that has been boiled or 100% cooked or exposed to heat. Is that true?
That's partly true, yes. Most of the infection, not only H. pylori, other things as well, other germs, other bugs, viruses or bacteria, they do actually transfer to people through unwell cooked food or salads. And if you go to a clean restaurant or you trust that restaurant, that's fine, you can eat whatever you want. But if you have doubts, or you look at the food and you think it's not clean enough, or sometimes you can smell something,
especially like buffets, for example,
buffets
that provide meals for hundreds of people.
Yes, sometimes they are fast, they're quick, they reheat things. You know, these are things where you really need to avoid them, and we do see that a lot. And we see them in patients who are traveling a lot. They present with a lot other symptoms. Vomiting, diarrhea, abdominal pain, and then fever sometimes. And you know, sometimes we get these people who get this weird infection somewhere in outside country we don't know about, or it's difficult to treat at the beginning, or we don't have enough antibiotics for them. So always, if you're traveling, and this is the main advice, if you're traveling abroad, if you're not trusting that restaurant, avoid these uncooked food.
Doctor, now we spoke a little bit about the treatment that is available at clinics, but can we talk about the diagnosis?
Yes.
What is the test that is most accurate to tell you that whether a person has it or not?
Yeah, see, there are multiple tests you do. So you have the symptoms, you go to your clinic, to your doctor, and you start to ask them, I may have H. pylori, or the doctor will ask you, you may do, we need to do some investigation to check if you have H. pylori. So the main one, the easiest one, and it's a good results, we do the urea breath test. That's where they send you to the lab, and you be fasting.
Is that the balloon test?
Yes, and then you blow in a balloon or a bag, and then you get the test if it's positive or negative. The other test is you can do a stool sample. We take a sample from the feces of the human being, and then we send it to see if they have the H. pylori.
So which one is more accurate?
They are all the same, almost the same, but we prefer the urea breath test because it's easier for the patient and it's quicker. The other thing, if the doctor thinks that you have complication of the H. pylori, they may ask you straight away to do the endoscopy. So they do camera test through your mouth and look inside your stomach, and they take a biopsy, a small sample tissue, to send it to the lab to investigate for the H. pylori. So these are the three main things. There are also what we use the nuclear medicine as a new technology, where we use the radioactive substance to check for the H. pylori. It's safe for the patients, and we use that in our hospitals to check for the H. pylori. So
I think that one is less available for everyone, and
it is available, but it's on demand, let's say, okay, because it's expensive. So that's why it's not the first choice for most of the clinics, but it is there. So if the doctor wants to do it or request for it, it's available.
Doctor, can we speak a little bit about natural remedies? Now, a lot of our parents always recommend that you go natural, or how they treated things in the past, telling you to avoid antibiotics at all costs. And they would start to recommend things such as pomegranate peel, garlic, and whatnot. What do you think of these remedies?
Okay. I hear this a lot, all right? Let's make facts clear. You want to use them, use them. I am not against them. But we don't have evidence they treat or they are alternative to the antibiotics. This is a microorganism. It's a live thing, needs to go dead. And the only thing you can get rid of it and kill it is the antibiotics. Anything else you can use as a help, as an assistant to help in that way, can maybe relieve your symptoms, but it will not kill the bacteria. The bacteria is there, needs to go away with the antibiotics. The antibiotics go inside the bacteria and actually destroy their wall and make them die. They go away, they disappear. Anything else I'm not against, but discuss it with your doctor.
A lot of people avoid antibiotics because of the fact that antibiotics also gets rid of all the probiotics that are inside your system,
true.
and then your system weakens eventually.
True. That's absolutely true, and I agree. We don't like the antibiotics. Our doctors, we don't like antibiotics. We try to avoid them. But sometimes you have to do them. There is no other choice. You are between the two things. Either you leave it or you get rid of it. And the only available way now, scientifically approved and evidence-based, is the antibiotics. And the antibiotics is a short term. It's only probably 10 to 15 to 14 days. And yes, it does kill the other bacteria because the antibiotics cannot differentiate between the bad ones and the good ones, but you can recall or we can correct that if it happens. But we have to get rid of it. There is no other choice of it. And patients who actually go to the other side where they avoid the antibiotics, I give them this advice. You are taking a risk. You are taking a risk of developing cancer. You are taking a risk of developing ulcers. And you can avoid that risk by taking antibiotics. Because whatever the antibiotics will do as a side effect, it's not as intense or as dangerous as the complication of the H. pylori. And I have to make sure that I have always to tell the patients, and through this program also from your side, I want to tell them, if you use the antibiotics, and you get rid of it, you have to confirm that you don't have the H. pylori. So you have to redo the test again after some times with your doctor to make sure it doesn't go. This is how much we really want to get rid of it as doctors, because it is not good to have the H. pylori inside you. So if you don't use the antibiotics, you are in risk of continuing having this H. pylori inside your stomach, and the risk of complications which you really can avoid easily.
Dr. Ghanem, thank you so much for being with us this morning. Very informative as usual, and I hope that people take H. pylori more seriously now that we are aware of all the complications that may occur in the future. Thank you so much.
Thank you for having me, and thank you for this nice conversation. You are great, and I wish people they do follow the evidence. They don't listen to the rumors. They don't get the information from unknown source. Get the information for the source. The Ministry of Health in Kuwait, they have available information in English and in Arabic in all the social media platforms, and the doctors are talking on the social media as well in Kuwait. And I wish the people to enjoy their life, have a good life, healthy life, and enjoy the weather.
Thank you very much. That was everything with our guest, Dr. Ghanem Alsalem, a consultant in internal medicine and gastroenterology. Let's go for a short break and we'll be back.